Thank you, Mr. Chair, and thank you for being here this morning. Just to quickly follow up on those questions regarding number 12 here. I've seen other jurisdictions who offer free testing, and I want to just comment that it's been a barrier for some people who have private wells. Maybe they even live in a municipality where they don't have access to water. And especially people in my community have experienced droughts where their wells have run dry, and they've experienced problems because of that. And the testing can be a barrier for them in terms of cost. So I just want to note that. I would like to ask, in terms of cyanobacteria and the algal bloom action plan, the protocol that's been developed, can you outline exactly what gets tested and when in terms of the protocol for cyanobacteria, please?
So when a report of a bloom comes into our regional office, staff will go on site and do an assessment. So a water sample gets collected, that sample gets sent to a taxonomist, and so they will identify the species of cyanobacteria present, if they are present, and do a cell count. And so those two pieces of information is then shared with Department of Health, and they use that in the risk assessment to determine if an advisory is needed. So there are situations where a bloom may have come and gone, and by the time we get there and we take a sample, the cell counts may be very low, or they might be high enough to warrant an advisory.
Okay, thank you. And so is it just identifying the species and doing the cell count that happens? Or do you test for any cyanotoxins?
For those site assessments, we're just doing site species identification and cell counts, but we're in the process of doing cyanobacteria surveillance. So part of that is with our PC, they're getting online with doing some various piloting of testing methods. So it's our hopes to be able to have that option in province to do additional testing for toxins. It would be particularly for microcystins.
Thank you. So up till now, is there ever testing of cyanotoxins, or that's something that you're hoping or you're planning to have for the future?
I can speak to, and I think it was up there in terms of some of the research that is ongoing that's been collaborative and funded to start that kind of analysis and look at that specifically. So when that information comes from Moncton with Dalhousie and Mount Allison, we'll be able to build on that information.
Okay, thank you. So just to be clear, there has been no testing of cyanotoxins for in New Brunswick.
That's where it's left with the universities at this point. And as was mentioned earlier, there is that genetic testing that has been funded to look at the potential for a species to be able to produce toxins, so that it is a surrogate, a view to that potential being there. And that's with RPC.
Okay, thank you. So I'm just trying to be clear, there hasn't been testing of cyanotoxins in the freshwater bodies, in the rivers. There's research to develop a plan for that, and I guess I did see that there was some testing though with the municipality of Moncton. Would that be correct? Could you tell us more about that?
That is something they're doing themselves, but again, it's not that there hasn't been any testing. UMB is doing some of that testing. We're in collaboration with them. We're getting updates on what their findings are, and this is going to inform how we can look to the future.
Okay, thank you. So maybe we could say there's sort of pilot projects to do some testing in some places through university research.
Like, it's to give us some indexing and then to help us decide where we go from there and help inform the public. Ultimately, that's what's most important here.
Okay, because I'm trying to understand if the province has an understanding of which cyanotoxins have been in the waters in New Brunswick, and where and when and how much. And it sounds like I understand there's been increased tracking of algal blooms, but we're not there in terms of regular testing for cyanotoxins.
Again, this is something we all recognize as being important. This became quite evident in 2018 when we saw what we did with, in terms of the dog deaths on the St. John River. I live on the St. John River, and so I'm a resident that with concerns as everyone does, but really the investment is making sure that, if you want to call it pilot or the research, so that we can move forward in the right direction.
Thank you. And when did this research begin on the testing component?
It was actually started in 2018.
In 2018, okay. And from what I gathered, it looks like around 2010 is around when some of the first locations with algal blooms started to be really tracked. I looked on the ACAP website, which I know is connected with what you're doing, and that's what I was noting.
That dates back, as you mentioned, to 2010, where there was an agreement with Department of Health to begin doing that.
Okay.
I think it's important to also realize that I think there were numbers demonstrate that we have 22 bodies of water out of 2,500 or so, and we're in a good shape comparatively. We're on it. We're looking to the future and what is going to be needed in terms of climate change and what we may see, but I want to make sure we're putting it into perspective as well for the entire province.
Okay, and that would be 22 based on people having reported it to you in a timely manner, and you having gone, and I don't know if you include ones where it's gone by the time you get there or not, but that would be based on reporting from the public.
That is correct. However, once a bloom has occurred in a body of water, it always remains on that list.
Okay. And so I guess I was wondering what type of data there was around the existence of cyanotoxins. I understand there's a variety of them, and there's different toxins basically that can be produced. One that has come up a lot is BMAA, and I guess there has been testing in the city of Moncton. Can you speak to I guess what's been found so far in the province, in terms of anatoxins, microcystins, BMAA?
At this point, there's no commercial analytical lab that analyzes for BMAA, just to kind of start. And it's not monitored as a toxin by the EPA, the WHO, or any state in the US at this point. So I just wanted to put that kind of out there as a benchmark in terms of the investment that looking at something very specific like BMAA would require. And it remains a substance or compound of interest, but there's many toxins and numerous bodies of water globally beyond BMAA, and there are other types of toxins and health effect issues that I think are more relevant perhaps than this particular one. There has been data studies that the EPA, for example, in the US have done. That suggest a correlation with some neurological conditions. However, no causation has ever been proven. And so we're looking at, data very broadly. And even some of the early data, I know it's been dated back to, evidence of neurological conditions that occurred in Guam, but some of those analytical methods from that time period are fairly outdated and brings into question some of that evidence from that time period. So I just want to be clear that it's not something where we're not interested in, but we're looking at it, with our partners across Canada. Currently, nobody's really testing that specifically, and so we'll keep an eye and do what we need to do should that arise as something, whether it's WHO, EPA, or our partners across Canada identify as something that is of greater interest than it is today.
Okay, and so as you said, there are some studies pointing to possible links with neurodegenerative diseases related to BMAA, and also looking at just, cyanotoxins. And we know that there have been cyanotoxins found, anatoxins and microsystems in, for example, the Moncton area, their water reservoirs. You could extrapolate from that that may be true for other water bodies in the province. Can you speak to what concerns you might have about what this means? And obviously there are consequences potentially for wildlife, and there can be bioaccumulation of cyanotoxins. Another concern would also be human health impacts of these things. Can you speak to that, please?
Well, again, I go back to, we are continuing to follow this research. It's on our radar. There are no guidelines in relation to BMAA at this point. And again, it was very well stated by Dr. Fox earlier in terms of our involvement with CCME, and we work with those partners, and we will be not just what we're following, but anything that becomes apparent through that organization and the evaluations and the summation of research data that they are able to provide as a committee and as a group. They are looking at what may need to be into future guidance documents and such, but at this time there are no guidelines in relation to that.
Okay, and I guess it's not just BMAA. There are different toxins that we're talking about being present. At least we know in the Moncton drinking water at certain times, potentially other water. And can you speak to your involvement in the research and investigating? You brought up the neurological, potential impacts of some of these things. Can you speak to your role in investigating potential neurological impacts of these types of toxins in New Brunswick?
Certainly, in speaking before, we, We also looking at, our Health Canada guidelines in terms of requirements, but I would defer in many ways to our public health partners for some of those very specific questions.
Although environmental public health got moved under your department.
And because I certainly was at Health during a period of investigation, I mean, they're the specialist in terms of neurologist or otherwise, those remain with the Department of Health. Information that gets provided is really there and rests with them in terms of any impacts around human health. We right now are working with, as mentioned, RPC on protocols and making sure that we can do quicker testing. We talked about qPCR and test strip testing and those other kinds of things that, from an environment perspective, we can help feed information so that we can react more quickly should that be a requirement.